Welcome to the instructional video on how to assess a central venous access device by the Canadian Vascular Access Association. There are 3 steps involved in the assessment of a central venous access device, or CVAD. The first is to assess if the device is necessary. Is it still needed and actively being used? The second step is to assess the site and the device. The third step is to assess for patency. For the purpose of this video, our CVADs have been deemed necessary, and the next steps of a CVAD assessment will now be demonstrated. Step 2. CVAD site and device assessment.
Now we are going to go through the assessment of 2 different types of lines that are commonly found on the chest. One is the tunneled CVAD, the other is the implanted CVAD. The tunneled CVAD is typically secured with the internal cuff as well as the securement dressing. The implanted port always has to have a non-coring needle accessed, and that becomes part of our assessment. So for the assessment, for both of them, you are going to ensure that there are no kinks or clamps on when you're infusing. You're going to ensure that the dressing is dry and intact all around the edges. And looking at the site, whether it's at the tunneled site or the implanted dome site, you are going to look for swelling, oozing, or redness. You're going to gently palpate around the insertion site and ask the patient if there's any pain or tenderness. In addition, you're going to palpate up along the vein path to assess, again, if there's any pain or tenderness. So now for the lines in the neck, you want to do the same thing, looking at the site and ensuring that the dressing is dry and intact at all the edges. You want to gently palpate at the insertion site, looking for oozing, redness, or drainage, and moving up along the vein path as well as down, asking the patient if they can respond if there's any pain or tenderness. So now I'm going to do an assessment of the PICC site, and we start with taking down any pieces of tape that are in the way. And over top of the dressing, we're going to palpate around the site, ask the patient if there's any pain or tenderness, note for any drainage or oozing at the site, and gently palpate up the arm for, again, any pain or tenderness.
Step 3. Assessing CVAD patency. Before you begin, review your organization's policy for assessment of CVAD patency and be familiar with it. Remember these key points when assessing a CVAD for patency.
We are going to assess for CVAD patency after you look at the lumens and identify if there's any obvious occlusion in the extension set or the needleless connector. We're going to scrub the top of either the needleless connector or the open lumen hub. Attempt to aspirate. If you cannot do that, you're going to flush 1 to 2 mils and then proceed to gently aspirate, pulling on the syringe plunger. Once you see blood come back easily, you're going to flush the lumen using a push-pause turbulent flush technique.
Remember when assessing the patency of a CVAD to note any resistance with aspiration or flushing and document it in the patient's healthcare record according to your organization's policy. In conclusion, the 3 steps to a CVAD assessment are important and easy to do. Remember to note any issues with the device, the site, and when flushing or aspirating through the CVAD. Finally, once an issue is identified, ensure prompt intervention to prevent further complications. The products used in this video were provided for demonstration purposes only. Occlusions may occur with any central vascular access device.